What exactly is type 2 diabetes, and how does it differ from type 1?
Well, more than 25 million Americans have diabetes, a leading cause of death in the United States, and the overwhelming majority of diabetes patients have type 2 diabetes. In addition, nearly 80 million more Americans aged 20 years or older have prediabetes, a condition that puts them at increased risk for developing type 2 diabetes. Now, in diabetes, your body has trouble breaking down glucose or sugar and converting it to energy. Type 1 diabetes is caused by a problem in the pancreas, whereby it does not produce a hormone called insulin. In type 2 diabetes, however, even if your body's pancreas produces sufficient insulin, your body has trouble using the insulin to break down sugars, a condition known as insulin resistance. As in type 1 diabetes, this leads to glucose buildup in your bloodstream, where your body cannot convert sugar to energy. Over time, your body may lose the ability to produce insulin. Type 2 diabetes is sometimes called adult onset diabetes because it is more likely to occur in adults. Type 2 diabetes, however, can begin at any age, and the number of children diagnosed with type 2 diabetes is increasing at an alarming rate, in large part due to an obesity epidemic in children. The exact causes of type 2 diabetes are unknown, though doctors do believe that genetics and lifestyle both play an important role. Being overweight is a risk factor, and in fact, more than 4 out of 5 people with type 2 diabetes are overweight or obese. Other risk factors include older age, physical inactivity, family history of diabetes, and a history of gestational diabetes in women. Your race or ethnicity also plays a role. If you are African American, Native American, Hispanic, or Asian American, you may be at greater risk for developing type 2 diabetes. Symptoms include feelings of tiredness, thirst or hunger, frequent urination, weight loss, blurred vision, and or slower than normal healing of wounds. For most patients, these symptoms develop gradually. In some patients, they may not appear at all. Only your doctor can diagnose diabetes. If you have diabetes, it is important to eat healthy foods such as fruits, vegetables, and whole grains, and to stay physically active. You'll also need to monitor your own blood sugar. Most likely, your doctor will prescribe an injectable or oral medication, oftentimes a combination of both, to help control your type 2 diabetes. Now, there's no cure for diabetes, and while managing type 2 diabetes may be frustrating and burdensome, if you eat properly, exercise, and follow your doctor's advice, you can still live a happy and healthy life despite this condition.